Okay, I'm going to go ahead and get things started here, and if folks join later on, that's great. Like I said, this is going to be recorded, so it'll be available for people. If you need a recap at any point, we can make sure that the video is available to you, and other folks will have access to it as well. My name is Ryan Berard. I am the new Associate State Director for Advocacy at AARP Massachusetts. I started with the organization in October. And I'm, as of next week, will be here 5 months. One of my colleagues in our outreach department, Paulie Mendoza, is also on the call to volunteer opportunities in the past as well. If you want to take a second to introduce yourself, Paulie.
Yeah, hi everybody. Really nice to see all your faces. I am here for you if you need any support along the lines of the volunteer portal, general volunteering at AARP if you're looking to expand beyond the advocacy department as well. We also have a really great volunteer conference coming up on April 25th at Holy Cross in Worcester. And so any questions you might have in regards to that as well, you can send me an email and I'll put that in the chat.
Yeah, so we will make sure to include information in the chat that's necessary for folks. And also after the meeting today, we will be able to send you the presentation that we're going to give and also links to all the information that we're going to talk about today. So no worries, no need to take notes or anything like that. I'm going to try and breeze through a quick presentation on our advocacy work. This is the first of these meetings, and we're looking to make them, like I said, on a once a month basis. We'll try to keep the agenda quick and tight. And the most important thing is to keep folks informed about what's going on here in the state and at the federal level in ways that you can engage around the issues of advocacy that we are working on right now. So I'm going to share my screen and go through this presentation. It may be a little familiar for folks who have been around for a while. If you have any questions, I'm going to go through it relatively fast, but please, if you have questions, I'm going to leave plenty of time for those at the end. So let's get started with this. Hope folks can see my screen here. Advocacy 101 in Massachusetts. So basically, we're going to talk pretty briefly about what it looks like to be an advocacy volunteer in Massachusetts, and also some of the things that we are working on right now. So advocacy at every level, federal, state, and local. Obviously, AARP has our hands on just about everything. As you might imagine, we are the preeminent organization for aging in the country, and aging touches just about every advocacy area you could imagine. Congress, who I'm sure you're familiar with, for good or for bad, is made up of two branches of government. The same is true here in Massachusetts. We have our own House and Senate. They roughly do the same types of things that you're familiar with in Congress. Things operate a little bit differently here, and we'll briefly go over what that looks like. But for folks who are unfamiliar, we do have a bicameral legislature. Our legislature is in session all year long, and they pass the laws that govern our state. What we don't do in terms of advocacy work is endorse candidates or elected officials for office. Some organizations endorse or give money to candidates. That is not what AARP does. We don't have a political committee or a PAC. If you're familiar with PACs, super PACs, we don't engage in any of those types of things. We do advocate for issues that matter to older adults, and we work bipartisan. We work across political lines in a bipartisan fashion with anyone who is willing to work positively on the issues that we care about. And we make sure that we communicate with all people who are elected to office, including candidates for office, so that they're informed and aware of the issues that are relevant to our members. Some of the areas that we focus on, the two biggest ones, are health security and financial security. Those obviously include a lot of other areas like Medicare, caregiving, long-term care, nursing home care, in-home care. Financial security includes things like Social Security, obviously, saving for retirement, taxes, property taxes being a big one. These are the two largest areas of focus, and boiling them down to health security and financial security makes it a little simple and understand, but there's a lot under those two umbrellas. Our priorities in Massachusetts for this calendar year, 2024, are passing a new caregiving tax credit through the House and the Senate and getting it signed by the governor, passing a work and save plan that will allow folks to who don't have access to retirement savings at work to have that, advocating for and transforming our long-term care and nursing home sector in the state, and working on prescription drug reforms that will make those drugs more accessible and cost-effective for individuals. How do we get there, you might ask yourself? Well, caregiving is a huge priority because, as we've seen over the years, caregiving is on the rise. We have in our state about 780,000 caregivers. They provide about $15.1 billion of unpaid labor, and they are really holding up our long-term care system. Many people might not think of themselves as family caregivers. You know, if you're caring for a spouse, for example, or you are caring for a parent, caregiving might not be what you'd call it. I know that I, make the trek up to Lowell. I live in Boston now. I make the trek up to Lowell every Friday to do the grocery shopping for my grandparents, drive them to medical appointments when necessary. If I ever said that I was my grandfather's caregiver, he'd probably slap me upside the head. But it's real, and people don't necessarily see themselves that way. So one of our goals is to make sure that we're bringing more light to the caregiving issue. Caregiving cuts across gender, it cuts across age. The millennial generation is making up a quarter of all caregivers now. So it's really affecting a broad segment of our society. The family caregiver tax credit give a little bit of relief to folks who are caregivers. We know that caregivers spend over $7,000 a year out of pocket on caregiving costs. So by passing this caregiving credit in the State House, we are hoping to be able to give some sort of respite to folks in terms of the financial burden that they take on through the caregiving process. And we have two great leaders in the House and the Senate, David Rogers from Cambridge and Jason Lewis from Winchester, who have sponsored the bill. And it's made its way through various committees in the State House and is now what is currently on an extension order. We'll talk a little bit more about the legislative process in a minute. Moving on to retirement savings. As you can see on this slide, people who are auto-enrolled in employer participation plans are significantly more likely to save for retirement. However, a lot of people are not fortunate to have retirement plans offered by their employer. We currently have in Massachusetts what's called the CORE plan, or the Connecting Organizations to Retirement, and it allows nonprofit organizations with 20 or fewer employees to offer 401k style plans for their employees, and it's run through the Massachusetts Treasurer's Office. There's a bill that exists in the State House right now that would expand it to all nonprofit employees, which would obviously be a great start. But there's more that needs to be done so that more folks across the state who don't work in nonprofits can save for retirement as well. That's where some of our other plans, including a work and save plan, come in that would allow for-profit employers to participate in a very similar plan that would be administered by the Treasurer's Office and increase access to those savings plans for for-profit employers. Seem to have skipped a couple of slides here. Not sure how that happened. Hold on one second. Bear with me while I get back to where we're supposed to go. Here is the part where I really wanted to talk to you folks, and I'm sorry if it's a little small there, but this is the basics of how we get through our legislative session here in Massachusetts. It's a 2-year session that takes place beginning in the January of 23 in this case and ending in December of 2024. We have about 345 days of formal legislative session to actually pass anything. Now, the difficulty in that in Massachusetts is that you have to pass it in your House and your Senate and get it signed by the governor. The bills start out in various committees, work their way through. Hopefully they get positive, what we call favorable reports, and they end up either being voted on by the House or the Senate. To give you an example, there was a long-term care bill that we support that's been passed by the House, but not by the Senate. There's also a prescription drug reform bill that we support that's been passed by the Senate and not the House. To actually get those bills to become law, they have to be passed by both branches. They have to be the same language, and then they have to go onto the governor's desk. This is really where advocacy volunteers for AARP play a significant role in being able to move legislation. Myself, my colleague, Jessica Costantino, who some of you may know, our Director of Advocacy, can speak to these issues very well and can talk a lot about, the data. I'll stop sharing now. Can talk a lot about the data and really, get in the weeds with legislators. But what they want to hear is from folks like you. And one of the ways that we've engaged people over the past few years since the pandemic is through e-activism. That would include things like sending an email to your legislators, sending a tweet or a Facebook message or something like that. And it's a great way to engage. However, it's better if we can get folks in person, speaking with people in their communities. And that's something that we're really going to try and build out over this year. What we'd love to see is you're having the opportunity to take ownership, of your city or town, being able to call up your state rep or your state senator, host a coffee hour where you can invite, folks who care about these issues, and 4 or 5 of you can have a sit down and a real face-to-face conversation with your state representative or state senator. Now, I'm not suggesting that that's something that you're going to do tomorrow, but it's the kind of thing that if we can build the capacity to get there as an organization, we can actually start to make more of an impact on this. I want to stop here because I covered a lot of information and I want to make sure we have time for questions. But after we do that, I do want to talk about kind of the different roles of advocacy volunteers in AARP Massachusetts and how you can kind of go from that online activism to really being someone who can get to a place where you're comfortable reaching out to your state rep or your mayor and asking them to support the various pieces of legislation or the various campaigns that we work on across the state. So please, if you have questions, fire away. Great, no questions. That means I did a great job. Yes, Linda, go ahead, please. I think you're on mute.
Oh, okay.
There you go.
Nice to meet you. Jess is still in the picture, right? Jessica?
Yes, Jessica is actually today at our Ways and Means hearing on healthcare and human services. So the state budget, which is one thing that we didn't talk about in the presentation, is the most significant piece of legislation that gets passed every year.
Yeah.
And basically it encompasses every department. It's funding for every program that the state does, and the state Joint Committee on Ways and Means is holding a series of hearings across the state. Today's is about funding for all the kind of programs that we care about, elder affairs office in particular, and health and human services in general. And it's in Burlington. So just drove up there to listen to the hours of testimony today about the various programs and the funding for the programs. But yes, she's very much still in the picture. She is our director of organizing and someone with whom without whom I would be at a great loss, because as I said, I've only been here for less than 6 months, so I'm leaning on her heavily and her expertise and knowledge.
So just one other question, because I have to pop out early. So as long as we're on today's meeting, will we be on your distribution list for the future calls?
Yes, you
And
will
so
be on
we'll
the
be getting
on.
emails to
Mhm.
be in touch with our legislators in Massachusetts, so on, and
Yes,
federally as well.
yes, absolutely.
Okay,
You'll be on the distribution list for the calls, but also I'll make sure that you're on the. Most people should be. If you're not already, you'll be added to the list of advocacy update emails that go out twice a week that talk about if there's a hearing, for example, that comes up in the State House that we want to have people weigh in on, provide testimony for. If there is a local action in your community that needs attention, those things are all going to be put into our bi-weekly advocacy emails. So if you're not already on that list and getting those emails, I will make sure that all the folks who are on the call today are added to that distribution list.
great. So there will be opportunities to do testifying in person and the like.
There are opportunities for sure to testify in person. One of the positives, I try to stay positive. So one of the positives that came away from the pandemic is a lot of the legislative hearings are now done in a hybrid fashion. So if folks are unable to come into the State House, you can still either participate virtually or submit written testimony. Um, I am of the mind, and I've always operated this way in my career, is that you kind of this business is done better face to face. So if people are available to be able to come to the State House, certainly not on, an every day or even an every month kind of basis, because even the legislators have taken to embracing the hybrid model, and a lot of them are working from home a lot of the time.
Yeah.
But if we have opportunities to get in front of people face to face, we will definitely keep people in the loop. And if that's something you want to do, there will be chances to do it.
Great, thank you so much.
Thank you.
Yeah.
Ellen?
And I don't know if you're going to cover this separately, but one thing I noticed when I went to the program in Framingham this past spring, I think it was, we met up with folks, and in my case, I live in Ashburnham, Mass. Most of my life is in Westminster, Mass. But I ran into a woman from Gardner, and she talked about their regular meeting programs. And when I brought that up with other folks in my community, they said they really wish they knew of AARP groups that were already established in the different regions so that they weren't making assumptions like there's nothing here and I need to work on starting a group where there may be, and we're just not connected to the group. And I
Yeah.
didn't know if you folks have any kind of listing or a way for us to make those connections, because like I said, the women in a women's fellowship group that I was talking with are very active, but said, you know, is that something that we need to work on forming? And I thought I'd rather ask first to see if we already have things and we're just, like I said, not on a list,
Mm-hmm.
or
Yeah, no, it's a great question, and Polly could probably talk to this a little better than I could. There are chapters, that exist in the state already. If you want to cover that part, Polly, you can, but I can jump in with a couple other things too.
Yeah, I'll just give a brief overview. So Gardner is one of our 2 chapters that are left. So there's a chapter in Gardner, and then there's a chapter, our West Grove chapter in Boston as well. And so that would have been the conversation that you probably had at our volunteer summit last year. As far as, what's going on in each individual community, we do our volunteer network meetings each month, and that's an opportunity for people from their community to come and have conversations with us about what's happening in your area. And we can help mobilize people to perhaps offer a table at an event and distribute information that AARP offers in your specific community. And that's something that we work on in the network meetings, which is the third Friday of each month. So we have one actually coming up this Friday. So you're welcome to email me if you want more information about that.
Thanks, Polly. Yeah, I was going to say too that beyond sort of the official chapter status, one of the things that is a focus of mine to build out is, you know, it doesn't necessarily have to be a group. And this is something that I'm kind of expecting to facilitate myself, at least throughout the first year, is making sure that our folks who are active volunteers in their community are aware of what's going on at the local level, so that if they want to participate on, on the ground, they'll have the information and opportunities to do that. And one of the ways that I'm sort of foreseeing that playing out is through this this effort that we're making on caregiving. And in particular, what we're trying to do is raise awareness about, you may not think of yourself as a caregiver, you may not think of caregiving as, your primary duty or responsibility, but in many ways you may be a caregiver. And even if you're not now, you may think to the future, one day you might be a caregiver. So bringing public awareness to that, A. B, coming up with actual policy and regulatory changes that we can make. And by doing that on the local level, the wide net. So what I've been doing is going around to local cities and towns, talking to the mayors, the city council, the state reps, getting them to, kind of raise their hand and say, and we want to do that more. We want to have more communities, declare themselves as supportive of caregivers. We want them to pass a proclamation in the city council. Those are all the kinds of things that, as a advocacy volunteer, that I would envision people being able to do in their communities, because you're on the ground there, so you probably know who your city councilor is. I had a great conversation the other day with someone who told me, "Oh, of course I know the mayor. Yeah, I was the nurse when he was born." I was like, "Oh, well, I probably have a closer relationship than I'll ever have with him then." So things like that are really what I hope to foster in terms of advocacy volunteerism, making it so that people have the resources to be active and engaged in their communities where they want to do that work. Any other questions before I move on to the kind of the final piece of this? No? Okay. So that's a good lead into the role looks like. It doesn't look like one size fits all. It's going to be different for everyone. Those opportunities that are very simple and straightforward, advocacy alert, we want you to contact your state rep and state senator, click this button to send an email today. Then there's kind of the broader scope, which can be inclusive of that, but also would include things like, would you be willing to come with me to a meeting with the mayor and talk about why protecting your Social Security matters, or why making the sidewalks passable so you can get to the grocery store makes a difference for you and the people that live in your community. So it's a more active, more engaged, kind of includes the more in-person element. Then you've got the things that Linda was referencing, like testifying for various bills that come up, either in the state house or on the local level. Those types of things are things that if you are a true passionate person about an issue, I mean, we have reams of research that you couldn't even imagine that will make you an expert, believe me. But you don't have to be. The role that I play, the role that Jess plays, are really to be the experts on the issues, to know all the data, to understand, and more to elected officials than hearing all that stuff is hearing personal stories about why you care about these things, your own lived experiences, and that's especially true if you're one of their constituents. And ultimately, what I would love to have, are folks who are super passionate about healthcare related issues and you become a lead volunteer on all of our issues related to that. Or if you about health or financial security, or Social Security in particular, and you want to be the lead in Gardner or Ashburnham on any of those types of things. Those are things that we're going to build out, over the course of my tenure here, and find ways to integrate them into the broader, larger process. And all that's going to be done hopefully in conjunction with the work that Polly does, with all the other kind of volunteer programs that we have. There will naturally be an intersection between, folks who want to be part of the Speakers Bureau and are giving presentations around that. Because again, that's local advocacy in my opinion. And if you're engaging on that, it's a pretty short step to engage with your mayor or your city council. So my hope was to keep this to about a half an hour. We're blocking off 45 minutes for these meetings every month. They won't always be 45 minutes because I like to keep meetings short, and I'd rather have people out and doing things rather than sitting on a meeting. So I'm happy to hear or take any other questions, but we have a number of materials, including the presentation that I shared that has some helpful links on there, as well as my contact information that folks will get after the meeting. Please, if you're able to, come back next month. The structure will basically be updates about the legislation that is pending on the federal and the state level, updates on the caregiving campaign that I touched upon, the Social Security campaign that we're working on as well, and the various ways each month that people can be active on any of those campaigns or all of those campaigns, however folks choose to become engaged. And as Polly said, she is the point person, the knowledge base when it comes to the volunteer portal. If you're not familiar with the volunteer portal, there'll be information that goes out talking about that and the kind of the next steps to sign up on the volunteer portal. And if you don't have any questions now, my contact information will be included and you can reach out to me directly. But I'm happy to take any other questions that folks might have. Yeah, go ahead, Ellen.
Can you just again comment on the Friday program that the third Friday?
Yeah. Yeah, I'd happy to do that. So we have a volunteer network meeting on the third Friday of every month, which is from 11 to 12. In March through November, we do hybrid options. So if you'd like to be in person, you're welcome to come in person. We do our Boston Volunteer Network at the Boston State Office. And then the Worcester Volunteer Network is, this month is out at the YMCA in Worcester, downtown Worcester. But for both meetings, we have virtual options. So whichever group you're closest to, you're welcome to join that virtually as well. And you don't have to be from the Boston area or Worcester area to join either of those meetings. Again, it's an opportunity to discuss what's going on in your community and how you could bring the AARP mission out in your neck of the woods.
Thank you.
Yeah.
Well, thank you, everyone. I appreciate you all being the guinea pigs, if you will, for our first Mobilizations Monday meeting. I hope that you'll be able to join us. This will be recurring, like I said, every second Monday from 12:15, and we'll be scheduled for 45 minutes. If we need it all the time, we'll take it. If we need all the time, I assume that means that we're in the robust throes of making effective legislative change in the Commonwealth. And I hope that folks will be able to not only participate in those, but think about taking on an advocacy volunteer role as well. And as I said, this session was recorded. It'll be added to the volunteer portal and it can be accessed there. And we'll follow-up information will be forthcoming to your email. So keep a lookout for that. All right. Well, thank you all again very much. We hope to see you soon. And please feel free to reach out to me directly with any other questions. or if you're curious about ways that you can engage now before we get into it a little deeper next month. Thanks again. Have a good day, everyone.
Bye,
Thank you,
everybody.
Ryan. Thank you, Polly.
Yeah, thank you.